purpose of this call today is really twofold. One is to kind of talk about self-care, and in the midst of all of this craziness of we're all staying at home and trying to figure out how do we stay connected to our kids, how do we keep our jobs, all those kind of things. We're just going to talk about how do we take care of ourselves, and not so much hand washing and physical kind of things like that, but the mental and emotional and those kind of things, just to make sure that we're staying mentally healthy so that we can continue doing what we're doing. So that's one reason that we're doing it. Secondly, we want to, at the After School Network, we want to create some space for after school staff to be able to connect with one another. You know, it is hard. Most of us, not everybody, but most of us that get into this field of working with kids, we do this because we like that interaction. We like that engagement. And when we have to kind of pull back a little bit and we're just by ourselves, sometimes that can have an effect, and it changes our outlook a little bit. And so we want to create some space for you to be able to process some things, to just talk about what are you doing with your program, how are you taking care of yourself, those kind of things. So when we put you into those breakout rooms in a little bit, we'll have something for you to talk about. But if you get in there and you just want to talk about, I don't know how we're going to stay connected to our kids, and the conversation goes that way, that's fine. Y'all talk about that. In the chat, in the chat box, you can have private conversations with other people. Jennifer Reed, I could go, oh, hey, there's Jennifer, and I can private message her and we can have a conversation about, hey, what are you guys doing, where you are, and she can tell me and I'll tell her what we're doing. And so if you have those conversations in a chat and that's where you walk away with something helpful, I'm fine with that too, because we want to learn from each other. It's not just me. It's not just people at the network. So we want you to have an opportunity to learn from each other as well. So we're going to go ahead and get started. One of the things, kind of this, just to kind of let you know where this is coming from, some of the content is from a presentation I've done several times. I've done it at the Mozart Conference here in Missouri. I've done it at the National After School Association Conference a couple of times. I guess just once, and was planning to do it this year. Actually, I did it virtually last week. So some of the content is coming from that. Some of the content is coming from the National After School Association. They just posted an article today or yesterday about just taking care of yourself in times of stress. So I swiped some of their information in that. And I think this is as awful as this whole COVID thing is, and it is, I mean, it's awful in so many ways. It's almost time for us to be able to reset who we are and what we're doing because we have time. Right? I think most of us are not getting up out of bed and having to rush out and get kids to school and get to work on time. And, most of us are just in our house. So it's a time for us to take advantage of that. So if there have been things that you've wanted to work on, if there have been things that you go, oh, I've always wanted to kind of try that and see if I could do that, this might be the time to hit that reset button and try some of those things. So, and let me just say this before we go, this could be in every little section that I talk about, but during this time, make sure that you're eating well, make sure you're sleeping and going to bed, and make sure that you're getting a little bit of exercise every day. Am I freezing up? I don't know if that's me or not. My internet has been a little bit rough today, but I'm just going to keep talking and hopefully you're still hearing me. So, am I still there? Y'all still got me?
You're freezing up a little bit, but it goes clear.
Okay. Well, I'm going to just keep talking then. I'm not sure what the internet is doing today, but all day long it's been a little bit sketchy. So first thing, as far as self-care, is creating a routine. So just because you don't have to get up and go to work, just because you don't have that morning routine of shower, get coffee, kids at school, get in the car, drive to work. It's really helpful to just create a routine for yourself, whatever that might be. And that's something that you can decide, even for your kids. For my kids, my youngest is 15, and we've created a routine for him. So, let me turn off my video and see if that helps me a little bit. Maybe that will help. I saw somebody asked if we're having having trouble hearing. Am I still good? Can y'all hear me? Because you're all frozen on my screen. Somebody wants to chat to me and say, yes, Brad, keep going. When you
It
do
kinda
refresh.
We can
comes
hear
and
you.
goes, Brad.
Okay. Okay, good. Because you're all frozen on my screen.
Yes, Brad, keep going.
Okay, thank you. So creating that routine, creating a routine where you, maybe you get up and you go for a walk outside, by yourself, appropriate social distance, all those kind of things. But create a routine, because that's going to help you. It's so easy if you don't have a routine, if you're not going to work, to sleep till whenever you sleep, get up whenever you get up, and then you go, okay, so what do I do today? I don't know. But having a routine is going to help you kind of keep yourself together. Just a little trick that I heard, a guy that I don't even remember where it was, but he talked about working. He's working at his dining room table now, and every evening at 5 o'clock or 6 o'clock, he packs up his computer, he packs up all of his stuff, and he moves it to a different place in the house, because it kind of finalizes, this is the end of my workday, and now I'm home. So even creating routines like that, so that when he gets up in the morning, maybe he grabs his computer bag out of his room and he goes to the dining room table and he gets his computer out, and there's that routine of getting things set up. So create that.
So it looks like Brad is back. Brad, we've decided to all turn off our video to maybe help with the streaming.
Okay, that works. Yeah, and it could be the fact of having people here in my house. My wife is working, my daughter's home from college, my son may have just gotten on his Xbox, and so that's that may be part of it as well. So I apologize for that.
Terry
We've
asked
had
the-
people
Oh, go ahead, Terry.
in the chat box some of the things that they're doing. I finished the story for you about the guy who moved his computer at the end of the day. And so people are sending in some ideas of what they're doing to have that work-life separation right now.
Yeah, good. Good. And that is, I mean, it's a huge thing just to be able to have routine, and we don't think about it so much. There's a statistic that Duke University did a study that 45% of what we do every day is habit, and we don't even think about it. And so if we can have some things that we're consistently doing in a routine, it's so helpful just to kind of help our mental space, as well as, you know, I've seen several people exercising and getting a schedule, get dressed. I get up every morning, I put on shoes, I walk down my hallway. I don't need shoes, but it's a psychological thing for me to be able to go, yep, I'm going to work, I got shoes on. So I think just for the Mason staff, I think we're going to skip the breakout rooms. We'll just kind of have things in the chat, because I would hate to get everybody in a breakout room and then my internet goes off again, and then you're trapped in a breakout room and you can't get back. So we'll just adjust on the fly. This is all new for all of us, this whole Zoom thing, and sometimes the internet works and sometimes it doesn't, and sometimes we have what we think are great ideas and they are or they aren't. So I'm just going to keep going. One of the second thing I wanted to talk about as far as taking care of yourself is to unplug sometimes. Several things for that. So one is unplugging from technology. For most of us, if we're still working with kids or we're still trying to work with our programs, most of that is going to be done via Zoom or FaceTime or some kind of technology. It's really helpful to spend some time away from technology. So like for me, this is my 6th Zoom call of the day today. So I am probably not going to get on my phone when I get off of work, because it's just more technology. So unplugging that way is helpful. Another way to unplug is to kind of unplug from the media, from the news. We know what the news is saying these days, right? It's bad, and it is bad. But most of the time, you're just going to get how terrible things are. Here's another number. This number keeps going higher. This many people have the disease. This many people are dying. This is what's going on in Italy and Germany. And it's so easy to just get bogged down in that. So check the news when you get up in the morning, when you get to your office, whatever it is. but then unplug. Don't have the alerts on your phone. Sometimes they're helpful. I think in a situation, it could be something that you just need to walk away with and go, okay, I'm not going to check until I'm going to check at 8 o'clock. I'm going to check at noon when I get lunch, and I'm going to check at 4 o'clock or 5 o'clock when I'm done with my day, whatever. Unplug sometimes. And if you want to put in the chat, just what are some things that you do when you unplug, or do you unplug? What do you do during that time? There was an article that I read not long ago that we spend thousands of hours on our phones a year. And the question was, what did you do before you had a smartphone? So smartphone came into being 10 years, 11 years ago. What did you do before you had a smartphone? Read, watch TV, maybe go outside, exercise, whatever it might be. But think about, what can I do in my downtime that doesn't require me to be plugged in? So maybe that's just taking a walk in the woods, playing a game with your kids, reading a book, learning a new hobby or craft, some kind of thing like that. So give some ideas of what you do when you're unplugged. So just to kind of get out from underneath the news and everything. I'm not saying ignore it. I'm not telling you to run and hide and pretend like nothing's happening. No, pay attention, but don't be so consumed by what's going on. All right. Number 3, find an outlet of some kind. So much of what we do now is just tucked in one spot. For me, this is really hard, and I'm just being honest. This is really hard for me to sit at my dining room table for 8 hours a day. I'm a people person, and I need people around me, and I have my family, which is great, but my wife is working and my kids have got their things going on. It's always so helpful for me to be, even in the office, to be able to walk down the hall and to talk to Clint or Mark or Jason or whoever's around. And I don't have that. So I need to find an outlet outside of my work. So that could be exercise. It could be learning something new. My youngest son is 15. And he's about to lose his mind. We've been in the house for a week and a half, and he's going crazy. He's like, I don't know what to do. And I said, learn something new. Try some things. Well, I don't know what. Try learning how to cook. Try learning how to sew. Work out, and maybe you would love it. Go for a run in the neighborhood by yourself. Clint said juggling. But find an outlet, somewhere where you can decompress. If you are trying something new, if you go, I always wanted to write a book, now is the time. You have time, right? You might not be very good at it, and that's okay. When you're trying something new, remember, I'm not going to be good at it to start, but I'm going to get better. So find those outlets, things that you can do outside of your work, something that might be unplugged, which would be helpful as well. So looking at the chat box, working from home, reading a book. Yeah.
Brad,
Yes.
this is Natalie.
Yeah, go ahead.
Audrey had a question about whether the chat will be available later.
It does get saved, and we can see if we can figure out a way to post it somewhere or send it out in a pipeline. We will figure that out, how we can save it.
Right. We'll definitely figure out a way to share this, because there are many cool ideas and fun ideas and people sharing right now. It's fantastic.
Yeah, it's good. So how's my audio and video? Is it pretty stable at the moment? Like, it's not, I see a couple of
gotten much better.
Okay.
Yeah.
Okay. I'm going to try the breakout rooms.
Good call.
And hopefully you won't get stuck in there. So I'm going to share my screen. I'm going to give you a quote. And can you see that quote on your screen? Self-care is a priority and a necessity, not a luxury in what we do. I don't know who said it. It was just a quote that I found. Self-care is a priority and necessity, not a luxury in what we do. So I'm gonna move you to some breakout rooms, and I want you, just when you get in there, I want you to talk about what does this quote mean? to you? How do you see self-care? How do you understand taking care of yourself? If there's something that you were talking about in your breakout room that you wanted to share with all of us, if you want to just type it in the chat box, kind of what was talked about, what was a good idea that you heard. So go ahead and type those over there. I'm going to mute all of you again. So that way we're getting a little bit of feedback. So yeah, go ahead and tell us what you talked about in your breakout rooms that was helpful, or things that you know about that quote that self-care is a priority and a necessity. It's not a luxury in what we do. If you think about, you know, one example that people talk about is being on an airplane. And if you've ever flown, every time you get on a plane, they talk about in the event of an emergency landing, the oxygen masks will come down. What do they always tell you? They always tell you, put it on yourself first, right? Then if you have young children around you, then you can put it on them. So it's taking care of ourselves so that then we have something to give. So Courtney, your question about tomorrow's 3 o'clock Zoom meeting, the same as today. Yes, it will be the same content tomorrow. So obviously the conversations will be different. Hopefully my internet stays stable tomorrow and we don't have that issue. So it'll be different that way, but yeah. So when we take care of ourselves, we're better for the other people we serve. Yes. Rochelle in our group mentioned it was hard to prioritize self-care. So she put sticky notes to find a way to put it in our everyday lives. Great. Yeah. So yeah, so just taking care of ourselves in this time, because there will come a time that we'll have to go back to work, right? Those kids are going to be there, and we want to make sure that we're in a place that we can be helpful to them. So thanks for doing that. We'll do another little breakout room here in a minute. So the fourth thing I wanted to talk about as far as self-care. So the first one was creating a routine. Don't just float because you're not going into the office or you're not working the way you normally do. So create a routine. The second thing was unplug from technology, which we're all fully immersed in right now because it's the way most of us are doing work, is online, but also unplug from the media. And regardless of your political bent, right or left, there's a spin. There are people that people want to kind of use things to their advantage. And there's a lot of good information out there, but there's also a lot of misinformation that it's really easy to just swallow up. So sometimes it's good to unplug from the media as well as from technology. The third one was to find an outlet. Find something that you can do. I jumped into one of the breakout rooms and my friend Rita was talking about just being intentional with your time. So, you know, if there are those things that you've thought, I've always wanted to write a book, I've always wanted to learn how to crochet, I've always wanted to run a half marathon, whatever, now's the time. Be intentional about that time and use that as an outlet for your own self-care. The fourth thing that I wanted to talk about was just being able to talk to people. We're made for connection. We're built to be connected to those around us. And we find ourselves now socially isolated, right? We're in our own houses, and you can go out to go to the grocery store, you can go to the doctor's office, and you still see people. But we're missing the connection with our kids that we work with. We're missing our connection with staff. That is a little bit difficult. So talk to people. Be intentional about that. My wife, one of her best friends, lives in Phoenix, Arizona. And Tesha texted Rachel the other night and said, hey, will you have a cocktail with me? Tesha's in Phoenix. Rachel's in Columbia, where I am. She said, do you want to have a cocktail? So at some point, they're going to sit down and they're just going to have a drink and talk. Now, this is something that they could have done any other time. But right now, we have that time. So you don't have to sit down and have a cocktail with somebody. But, you know, call people that you haven't talked to in a long time and you've always wondered, I wonder what happened to that person. We used to hang out a lot. If there's drama there, you decide if you're gonna walk into it or not. But connect with people, connect with your coworkers. Use Zoom or FaceTime to connect with your staff, a phone call to the kids in your program, just a call home. We had a call yesterday and somebody said something about we're just making phone calls to our kids. There's no just to it. I mean, that's a big deal for a kid. If I'm a kid and Arlene is one of the people that works at my program, my internet connection's unstable again, it said. So I'm gonna keep talking, and I'm gonna trust that this is not gonna fall off again. So, yeah. If you want to turn off your videos again and see if that helps, as much as I like to see faces, it seemed to kind of stabilize stuff a little bit. So yeah, so Carla said, I miss all of my kids and my staff so much, and it's hard because you see them every day, right? So if I'm a kid in Miss Arlene's program and I've been home for a week and a half and I'm used to seeing her every day, but now I don't, and for me to get a phone call from Miss Arlene just saying, hey, Brad, how you doing? How's life? How are things at home? We miss you. That's a big deal. So contacting those parents, contacting those kids, phone calls, Zoom, where you can get 4 or 5 of them together on one call. I do know some programs or some school districts we've heard are not allowing Zoom to be used. Maybe you keep people accountable and you have 2 staff on a Zoom call. You record all of your Zoom calls. Maybe you can float that idea because they can all be recorded. And so somebody can go back and say, okay, this was perfectly fine and whatever. So reach out to those kids, reach out to friends and family, because like I said, we're made for connection. We're built to be connected to people. So it is helpful. It's a way to just kind of take care of yourself in the midst of all of it. So I'm going to try this. Am I still breaking up as I talk, or has it gotten a little bit better?
It's gotten better. We can hear you.
Okay. Well, good. So I'm gonna jump in again to these breakout rooms because that seemed to work well. So let me give you your next quote for you to talk about. So here's your next quote. Our greatest weapon against stress is our ability to choose one thought over another. Our greatest weapon against stress is our ability to choose one thought over another. So I want we're going to put you back in those breakout rooms. I don't know if they will all be the same. Let's stop this sharing. You may go back into the room with the people that you were just with. It may be a completely different group. But go ahead and just have that conversation. I'll broadcast the quote again to you so it pops up on your screen. Or if there's something else that we've said, go ahead and you can talk about that as well. So you've all been invited. You can go ahead and click join and pop out to those breakout rooms, have a conversation. Same thing as last time when you came back from the breakout room. If there was something in that room that you really liked or feel like it should be shared with the rest of us, go ahead and type it over there. Rochelle, thank you. The breakout rooms are very therapeutic. Actually, there were a few of us that stayed kind of in this main room, and one of the ladies said, this is very helpful. Reducing stress, just being able to talk. And that's what we talked about early on, that we want to talk about self-care, but we also want to create a place for all of you to be able to connect with each other. So go ahead and type those things in the chat box to the right. What was good in your breakout rooms? What were some ideas that people had about the quote? The quote, our greatest weapon against stress is our ability to choose one thought over another. So things about that, things about just what people are doing. So y'all can kind of scroll through those. So keeping busy, being diligent, keeping your thoughts positive. Yeah, thank you. Anna said, someone suggested a joke of the day with the kids in their Google Classroom. Mind over matter, choosing positive thoughts over negative. Yeah, so that's one of those things that we have the ability to not get caught up in that loop. We can choose to change the way we think about things and the way we approach things, but it has to be intentional. You might even have to physically stop and go, okay, my mind is spinning too much. I need to think about, okay, I'm blessed because I'm still healthy. Family's healthy. I got food, whatever it is that you can kind of go, yep, this is what I'm doing. Or thinking about how can I help other people tends to take your mind off of yourself, can kind of pull you out of that spiral. So, Audrey said, speak the thought out loud. There is a thing in counseling, just naming the problem, whatever that is, you say it out loud and say, I'm worried. I'm worried about whatever it is. I'm afraid of whatever it is. And so you kind of name that and you say it out loud. That's helpful. Terry, consider joining the Chat Pack. So the Chat Pack is a Facebook group for after-school workers. Started just for people working in after school in Missouri, but it kind of has expanded. So there are people from all over the country that are connected to it. It still has a Missouri focus to it. But yeah, it's called the Chat Pack. It's on Facebook. You just Google that or search it on Facebook and it will show up. So yeah, Erica Chrysler said, come. Erica is the administrator for the Chat Pack. It's a great way to just kind of stay connected with people. So not a ton of time left here. So I'm going to hit one more thing. And this is the last thing kind of that I'm going to talk about. We'll do one more breakout room. So this would be number 5 if you're taking notes. So 1, create a routine. 2, unplug technology and media. 3, find an outlet, something you can do outside of work. 4, talk to people, make those connections, reconnect with people that maybe you've lost those connections. And then number 5 is being kind to yourself. So being in this place where we are now may feel like, what am I supposed to do? Like, I want to help, I want to do something, but I don't know what to do. I don't know how to do it. I'm afraid of getting sick. I'm a whatever. Be kind to yourself. Our next quote, I'll just tell you what it is now. You can do anything, but not everything. So if you and your program are doing things, feeding kids, you got meals going out, those kind of things, but you go, oh gosh, we got to do more. We need to do this. There's so much need, and there's so much need, so many things that we could be offering to other people and to families and kids, but be kind to yourself. So the quote is, if you had a friend who talked to you the way you talk to yourself, would you still be friends? If you had a friend who talks to you the way you talk to yourself, would you still be friends? And Terry, this is telling me my internet connection is unstable, so it may go away again in a second. So, so anyway, be kind to yourself. There are things that you will say to yourself that you would never think to say to another human being because you're not built that way. But you'll tell yourself, oh, you're an idiot because you did, or you're not doing enough, or you need to be better at. So be kind to yourself. That's part of that self-care. You don't have to stand in front of the mirror every day and go, I'm good enough, I'm strong enough. But if that helps, then do that. But being kind to yourself. Don't talk to yourself the way you would talk to someone that you don't like. Be kind. So, because part of self-care and in the middle of all of this, part of that is just being kind to ourselves and learning how to walk through this. This is all brand new. All right. So here's your quote. You can do anything, but not everything. All right. You can do anything, which is true, but you can't do everything, and especially at the same time. So we're going to break out into breakout rooms one more time. Yeah. So M, I don't know your name either. So she said in the chat box, we have to give ourselves the same grace we teach our kids to have. That's absolutely right. Yep. Yes. Give yourself grace. It's okay.
Yes.
Because most of the time you would do it for somebody else. Like you would have grace and go, hey, yeah, you messed up. Don't do it again. Let's see how we can get it better and fix it.
Yeah.
And do the same for yourself.
Yes. Yeah. And every day is a new day.
Mm-hmm.
What happened yesterday, don't carry it on to the next day. This is new. Everything is new, and we're going to start out like it's new and forget yesterday. Today is today.
Yep.
And when you're talking about having a bad day,
Mm-hmm.
looking at it in perspective, was it really such a horrible bad day, or was it a bad portion of your day? Was it,
Right.
30 minutes of your day that was horrible? That's not truly a whole reflection of your whole day being horrible. It was just
Yeah.
a period of your day.
That's a
Right.
great point, Cassie. That's a
Yeah.
great point.
Yeah.
Because it could have been something that happened at 9:30, from 9:30 to 10, or 9:30 to 9:35. And you go, oh my gosh, it was such a terrible day.
And then
That's
you
right.
just
5
keep
minutes.
thinking about it, those negative thoughts, and then, then it can lead into a bad day. But if you just accept it in that moment that no, it was just something bad that happened as a portion of your day, and move on.
Yep.
Right. And
Yep.
you are what you say. And you keep saying you have a bad day, you're gonna have a bad day,
Right.
So you keep saying that, oh, I had a bad day, I'm having a bad day. Let it go. Move on.
Yes, that's it.
I like who somebody said it, important to put things into perspectives. I've a lot of times looked at it as first world problems, so this is a first world problem. There's other people in other parts of the world, who maybe don't have things so fortunate as we do. So
Right.
Yeah. So Corey said, I have a terrible problem with this, but I feel like this pandemic is helping me deal with self-reflection. I mean, it does. It makes you kind of look at what's important and how you're doing things. And
Yes.
yeah,
Yes.
that's a great point.
Yeah. It gives you being thankful. You get very thankful about things in life and things that you have in your life.
Yes. All right. So again, same thing as we've done the last two. If there's something in your chat room, your breakout room, that that, hey, this was really good, we should all know about this, go ahead and type it over there in the chat box, because this will all be saved. And Audrey, I think it was Audrey that had asked, would we be able to distribute it? So we'll find out what we get, or find out how we can do that. So Rochelle, we like ourselves. Good. I'm taking that as we like ourselves, which is a good thing. So thanks for that. Y'all keep those comments in the chat box over there. So over the next few weeks, so where we are in Columbia, we have a stay-at-home order until like April 24th. So we can go out and get food. We can go to the grocery store. We can go to the doctor, those kind of things. But otherwise, we're going to be home. So we have time, which is fantastic and awful at the same time. It's a blessing and a curse. So because we have time, maybe we'll be able to find those outlets. We'll be able to start those new habits and create new hobbies for ourselves, things that we'll do to take care of ourselves, and think about how can we serve other people in the middle of this, because that's what we're about, right? Serving our students, serving our families and our community. But we have to be able to be in a place where we are fit to help serve, right? And have something left to give. I think somebody put it in the chat box a while ago, and I have this quote on my burnout presentation, that you cannot serve from an empty vessel. So for you to be able to serve others, you have to have something to give. So you got to be able to take care of yourself. Find those things, reading a book, going for a walk, exercising, knitting, cooking, whatever it might be. Write a screenplay, and then when you hit it big, don't forget all the little people. All right, whatever it is that you're doing, go after that. Things to take care of yourself. So I'm gonna leave you with this last quote. I really like this one. This is from a legendary football coach of all people. Let me move this here. So this is just your last quote. Nope, that's not it. Come on, Lou. There we go. It's not the load that breaks you down. It's the way you carry it. It's not the load that breaks you down. It's the way you carry it. So we're all in this together, right? This is hard for all of us. And it's not going to break us down to stay at home. What's going to break us down is how we carry that and what we do with it. So as you're at home and you're trying to figure out what this new normal looks like, at least for the next month or so, then be intentional about taking care of you. Go to bed at night, get some sleep. It's a time to rest. Eat well. Don't just stock up on donuts and Dr. Pepper, although that sounds really good to me, honestly. But don't do it. Eat some vegetables occasionally. So eat well, get some exercise. Just go outside. The sun is good for you. Get some vitamin D. Walk through nature, whatever it might be. All right. So So yeah, so M, I don't know what M's name is. We need to remember the model we set for our kids. We set the tone. So we talk about resilience in kids. That matters to us as well. So for us, we need to model that resilience. Yes, this is terrible. I've told my son, because he's bored, he's done. I'm like, we got 3.5 weeks left, man. We have to learn how to be resilient. And as adults, we have to model that. He needs to see me be resilient because, oh, that's how it's done, right? So yeah. So thank you guys so much for joining us today. I'm letting you go about 4 minutes early, mostly because my internet connection seems to be stable right now, and I don't want to take that chance to keep going and keep you late. So thanks for joining us. Tomorrow is going to be the same content. Obviously, we'll have different conversations in the breakout rooms, but y'all take care of yourselves. Wash your hands, yes, all of that kind of stuff. Keep your distance, but take care of your mental health. Take care of your emotional health. Connect to people. Create a routine. All those things we talked about. Unplug. Find a good book, disappear into that, whatever it may be. All right. So thank you all for your time and your attention today. I've enjoyed it. We apologize for the technical issues, but hopefully that'll be fixed going forward. So thank you all very much for being here with us. Have a great rest of your afternoon.